So in this video we are going to talk about cervical myelopathy and the special test to examine cervical myelopathy like Lhermitte'sSign, Romberg test and 10-second step test. But before we'll talk about the special test to examine the cervical myelopathy, we'll discuss a little bit about cervical myelopathy. What is myelopathy? So in cervical myelopathy, you can see mainly the UMN lesion, UMN kind of lesions, like upper motor neuron kind of lesions, where you can see spasticity, clumsiness of hands, gait disturbances, and balance deficits. Now, cervical myelopathy is insidious in onset, where you can see a functional decline. And why cervical myelopathy? Because it can be the result of a compression of a spinal cord at the level of cervical spine, and you can see all that symptoms, and the pathological reflexes are positive, like Babinski, Hoffman sign. Now, sometimes, what is stenosis? Stenosis is narrowing of the canal, right? So, together stenosis and herniated disc will lead to cervical myelopathy. Sometimes, some patients have a congenital narrowing of the cervical canal. But if the canal is narrowed up to 60%, like less than 6 mm, all that patients will lead to 100% chances of cervical myelopathy. 60% of the canal narrowing or less than 6 mm. Asians are more prone to cervical myelopathy. If you want to see the numbers, like 1.9 to 4.3% of Asians over the age of 30 years are more prone to cervical myelopathy after the stenosis or herniated disc. Why? Because it can be because of the ossification of the posterior longitudinal ligament, which is the main source of compression of the spinal cord. Now, what compresses in cervical myelopathy? What compresses? So it compresses two tracts mainly. First, lateral corticospinal tract, which is responsible for voluntary skeletal muscles. And the second is spinocerebellar tract, which is responsible for proprioception. Two tracts, lateral corticospinal tract, which is responsible for voluntary muscles, voluntary skeletal muscles, and spinocerebellar tract, which is responsible for proprioception. That's why you check the Romberg's test. Now, if you see the cervical myelopathy affects the upper extremity more compared to the lower extremity, where you can see all the fine motor skills are affected. So if you ask the patient to button the shirt, if you ask the patient to manipulate the smaller objects like small coins or small pebbles or anything, patient finds it more difficult. Now, because of the clumsiness or the proprioception, if you ask the patient to comb the hair, these all things are more affected compared to the lower extremity, like compared to the balance or gait disturbances. Now we'll talk about the Lhermitte'sSign. The first thing you examine to check if the patient has positive cervical myelopathy. Now, Lhermitte'sSign, have you checked? Patient is in a long sitting position. Examiner passively flexes the head and hip up to 135 degree where the knees are extended, and patient may experience electric shock like sensation in the upper extremity, neck, spine, and even in the lower extremity. That means the Lhermitte'sSign is positive. Lhermitte'sSign is a combination of a Brudzinski test and SLR test together. Now there is something called as a Soto-Hall test. So in Soto-Hall test, patient is in a supine position, examiner passively flexes the head to the chest, and patient will experience the same electric shock-like sensation. That means the Soto-Hall test is positive. Now, Romberg test. So in Romberg test, you examine mainly the balance. So patient is in a standing position, ask the patient to close the eyes and hold that position for 20 to 30 seconds. Now, what you can see increase in a postural sway. That means the proprioceptors are affected because patient has closed eyes, so proprioceptors are responsible for balance. That means the Romberg test is positive. The third and most important is the 10-second step test. So you ask the patient to stand at a stationary position and ask to march where the hip and knee comes almost at a 90 degree of flexion. Ask the patient to march without holding any object for 10 seconds, march up to 10 seconds, and you count the numbers, how many steps patient has taken. That I'm going to post a link in the table where you can find where the age is positive. It goes with the decades, like 20 to 29, 30 to 39 years of age, and differentiates between a gender like male and female. And in that, all the positive Babinski signs are, all the pathological signs are positive in cervical myelopathy too. For an example, Babinski reflex, Hoffman sign, inverted radial reflex, and finger escape sign. If you ask the patient to go for a repeated grip test, patient cannot go for a forceful contraction after a repeated grip. Thank you.